second case. Another case of surgery, another case of implant retained prosthodontics. That is the most difficult, and I'm very involved in guided surgery and implant retained prosthodontics. This is my passion, okay? But this was not easy. It's absolutely an old case. I started this case in a pre-Titan era, okay? And the very difficult thing is was that the patient, there is a female, she didn't want at all to work on the lower jaw. That, to me, it was crazy. She only wanted to work on the upper jaw because it was more important to her. Okay. We started our analysis. We started all the process to have the guided surgery. During one guided surgery appointment, we have all the extractions, and we manage the surgical guides. We have all the implants, all the abutments, and this was this on the left. This was the provisional. Okay. It's not perfect, it's not so amazing in aesthetics, but who cares? Okay, the patient was absolutely happy with this provisional, and we maintained the provisional for 1 year because we lost one implant on the left side. And I managed this kind of failure with 2 new implants on that side. You can look here, okay. And after a while, we were ready to finish the case. So digital impression, 1 year after the first surgery, no Titan, okay, until this point. We will see. When I started Titan approach in this case, because this was a very good case. I didn't want fractures. I wanted to prevent. Okay, in the first case we saw that I managed the fractures, but in this case I wanted absolutely to prevent the fractures. Is there a way to prevent the fractures with no zirconia, with ceramics on Crobo Cobalto? Okay, 100% digital, and the gamma impression is very good. Scan abutment, only 1 appointment, and we designed the structure with my technician in the lab. We started using also a facial scanner at the time in 2015. It was one of the first try with facial scanner to me, of course. And we had 2 tries, okay, in 1 appointment. The first was an full anatomical try-in. There is this one. It was printed with resin, okay, and it's a shame that I didn't have at this point my Titan, because this is the best moment to have a Titan examination, and we will see on the next, or maybe on the last case of this webinar. Okay, but remember, you have to remember this: the moment of the try-ins before the provisional, or if you want, after the provisionals and before the final structure. The try-ins moment is absolutely the perfect moment to use your Titan and to rebalance, to manage the contact points. Okay, and we have aesthetics examination, aesthetics check, and of course X-rays to have a check of the couple of the implants and the structure. Everything on laser melting. Everything looks pretty good. The final ceramics, okay. Wow, my technician was very good. The first try in, everything was pretty good to me. Okay, it was a good case. Okay, good aesthetics. The lip was good. The patient was very happy. It's a shame not to work on the lower jaw, but okay, this is life. We cannot have 100% of what we want. And the question, and okay, I finished this case in 260 on the October, 4th of October. And are you pretty sure this is a good case? Okay, this is not a Congress. This is not a Congress when I finish with this image. Okay, this is a webinar, and I want to trust you. I want to be absolutely 100% sincere with you. Okay, so the truth is that at this point I started working with my titan. Okay, exactly at this point. It's not the right point, but it's the right time. But I didn't have before. And what about the contact points? I didn't want failures and fractures because it was absolutely a good case from the aesthetic point of view. Okay, and this is the result of the first titan examination with the final structure on the upper jaw. And look at this, the impact is very, very, very low. Okay, it's absolutely a good thing, a good news, because when you have low values of impact, you can manage the vertical dimension with a lot of easy way, because you can decrease the vertical dimension. Okay, you can take your bars and have a milling, maybe on the lower jaw in this particular case. And we have also an unbalance in the posteriors, the masseters, in the anteriors, and the barycenters is all on the anteriors, and there is also a little torsion on the right side. Okay, nothing that I can't manage with my titan. Okay, there's no way to manage this kind of things only with contact paper, no way at all. And okay, this is, to me, this is the right approach. So I started working on this point with my bars. Okay, look, okay, this is the previous slides. Okay, look at this, look at the arrow. Okay, look at the point, the blue point. This is where I want to start working with my bars on the intraoral side. Okay, I started working on that area. There is a lower cuspid on the right. Okay, and all the values became better, but they were not absolutely perfect. So another adjustment on this side, and everything was unbalanced on the other side. Okay, everything changed. This is the truth. Okay, it's not only a case for congresses. This is absolutely the truth. So I started thinking about this imbalance on the masseter side on the left, and the POC on the temporals is also on the left. The barycenter is on the anteriors. The torsion is on the contrary. Okay, we started, look at the previous again. We started with the torsion on the right side of the patient, and now we have to manage a torsion on the left side. There is absolutely okay, because we have the space, because impact is absolutely higher than before, but it's not 100%. It's lower than 100%. So I can increase. Okay, and a little adjustment and the impact increases and increases and increases, and everything looks absolutely good. Okay, this is the way to start the follow-up. And this is after 3 months. This is after 1 year. Okay, a little unbalanced on the left side, but look at that lower jaw. It's absolutely crazy. But that's life. Okay, it's not a perfect case, but on the upper jaw, in the last 4 years, we didn't have any fractures. And this is the same kind of ceramic that I used since 10 years now. Okay. And previous than Titan, I had a lot of fractures and I didn't understand why. And to me, the answer, it was not the use in 100% of cases of zirconia. Zirconia, it's very beautiful, but to me, it's too hard on implants. This is my approach. Okay, so this is Titan guided and full guided, full digital guided surgery and rehabs on implants. Okay, 4 years and no fractures at all.